Why does health equity matter, and what can we do about it? Hello, Katalin here as your host for one of the first episodes of our podcast series on health equity. And in today's episode, we are talking to Professor Gabbay to see what he has to say about health equity. He's the director of the Applied Research Collaboration, or ARC for short, of the Northwest Coast, funded by the National Institute of Health and Care Research that focuses on addressing health inequalities in the region. So Mark, you have been the director of the ARC Northwest Coast and its predecessor, CLAHRC Northwest Coast, for about 8 years now. So you have gathered extensive experience in this line of work. Why does equity matter? Why dedicate resources to it?
Okay, well, I think it's well known that inequity and health inequalities have been a big problem for a very long time. So it's been slow to shift. There was an improvement in the differences in average life expectancy in different parts of the UK and in England in the early part of this millennium, but then that started to drop again. And so the challenge remains how we can make sure that it doesn't matter where you're born, that your chances of a healthy life expectancy are as good as anybody else.
What is it you're hoping to achieve? What's your vision for the ARC Northwest Coast in relation to equity?
Well, the ARC Northwest Coast is an infrastructure. It brings together a wide variety of different types of organisations and people involved in health and social care, applied research and implementing that research into practice. And our focus has always been, since we set up the CLAHRC and on its predecessor, has been about health inequalities. And so to live and breathe health inequalities, to make sure that it's across all aspects of our work, which is why this is so important.
You've talked about then the challenges of health inequalities in this region and what you're hoping to achieve. How does research feature in this?
Well, we need to understand what is effective in making a difference to health inequalities. Is the big question. To be able to do that, we need to measure the impact of all the research we do, applied research we do in health and social care on health inequalities as one of the outcomes. And unfortunately, through the history of applied research, that's rarely been done. And if it has been done, it hasn't been reported. And one of the jobs we did in the CLAHRC was to demonstrate that and to try and help people look at that more proactively. So when they're designing a research project, how to make sure that they're thinking about what the health inequalities aspects of that are and how they can build that into both the data that they collect and the reports that they write, so that people who want to know, and does this make health inequalities better or worse or make no difference, can start to answer that question.
Is there something the public and those who are listening can do? How can people get involved in reducing health inequalities?
Well, when we set up the CLAHRC, which was in 2013, we were writing the bid, we looked internationally for any sort of toolkit that researchers could use that would embed health inequalities into their research thinking or equity. And there wasn't one. So one of the first jobs we did in the CLAHRC was to come together with researchers, professionals and the public to write that toolkit, which has now been refined and is on the 4Equity website. And integrated into that equity proofing of all of our research and major activities is public involvement. So you can't complete what we call a HIAT, a Health Inequality Assessment Toolkit online form, unless you've talked to the public. And to talk to the public, we need those people who are people with lived experiences, patients, carers, just members of the public with an interest in health or social care, to get involved in our work so they can help the researchers pull those things together and become our co-researchers.
That's great. You've laid out now all this great work that the ARC Northwest Coast is doing in relation to health equity. So how soon before we have some tangible outcomes?
We already have tangible outcomes. I think that the tangible outcomes are that the research that we do talks about equity. It talks about the impact of the different things that we do on equity. A lot of the work that we have done focuses on health inequalities. The Northwest Coast is particularly known internationally for its work in health inequalities, and I think we're part of that. So it's always, if you look at our outputs, that will always be in there.
That was the ARC Northwest Coast Director, Professor Gabbay, on health equity. Our next episode will be dedicated to our greatest resource, the patients, the public, and the communities that get involved in research. So make sure to tune in for a thought-provoking discussion around equitable patient and public involvement and engagement. In the meantime, use #ImplementEquity to discover tips and insights shared by the group in advance of our recording.